Hi everyone, I am Roslyn Anita from Tribhuvan College of Nursing. I am going to present the topic about anatomy of lungs. Objectives are introduction, anatomy of lungs, external features of lungs and fissures of the lungs, lobes of the lungs, bronchial tree, components of the bronchial tree, pleura, blood supply of the lungs, nerve supply of the lungs, conclusion and references. Introduction. The lungs are a pair of spongy, elastic organs located in the thoracic chest cavity and are essential for respiration. Their primary function is to facilitate the exchange of gases, oxygen entering the blood and carbon dioxide being removed from the body. The lungs are protected by the rib cage and are separated by the mediastinum, which contain the heart, trachea, and major blood vessels. Each lung is covered by a double layered membrane called the pleura, which reduces friction during breathing. Structurally, the lungs are divided into lobes and further into smaller airways that end in microscopic air sacs known as alveoli, where gas exchange occurs. Together, these anatomical features enable the lung to effectively support breathing and maintain proper oxygen levels in the body. Anatomy of lungs. The lungs are located in the thoracic cavity, one on each side of the mediastinum. They lie within the pleural cavities and are protected by the rib cage. The right lung occupies the right side of the thorax. The left lung occupies the left side and is slightly smaller due to position of the heart. Some of the external features of the lungs: apex, base. Apex, it's a rounded upper end of the lung, protects into the neck above the first rib, covered by the cervical pleura. Coming to the base, it is a broad and concave, rests on the dome of the diaphragm, moves up and down during respiration. Coming to the surfaces, each lung has three surfaces: costal surface, mediastinal surface, and diaphragmatic surface. In costal surface, it is a smooth and convex in contact with the ribs and intercostal muscles. Mediastinal surface, it is a concave, faces the mediastinum. It contains the ileum where bronchi, blood vessels, nerves, and lymphatic enters or leave the lung. And diaphragmatic surfaces are concave, rest on the diaphragm. Borders. Each lung has three borders: anterior border, posterior border, inferior border. Anterior border thin and sharp. In the left lungs, it shows the cardiac notch. Coming to the posterior border, thick and rounded, lies near the vertebral column. And inferior border, sharp, separates the base from the costal and mediastinal surfaces. Coming to the fissures of the lung, oblique fissures present in the both right and left lungs, runs obliquely downward and forward. It extends from the level of the fourth and fifth thoracic vertebra posteriorly to the sixth costal cartilage anteriorly. It separates superior lobe from inferior lobe in the left lung, superior and middle lobes from the inferior lobe in the right lungs. An horizontal fissures, it's present only in the right lung, runs horizontally at the level of the fourth rib and fourth costal cartilage. It extends from the oblique features to the anterior border of the lungs. Separate the superior lobe from the mid lobe. Coming to the lobes of the lungs, right lung divided into three lobes: superior, middle, and inferior lobe, and separated by the oblique fissures, horizontal features, fissures. Left lung divided into two lobes: superior lobe, inferior lobe. It's separated by the oblique fissures. The superior lobe includes the lingula, which correspond the middle lobe of the right lung. Coming to the bronchial tree. The bronchial tree is the branching system of air passages within the lungs that conduct air from the trachea to the alveoli. It begins at the bifurcations of the trachea and progressively divides into smaller airways, ensuring even distribution of air to all parts of the lungs. Components of the bronchial tree. Trachea, a tubular structure extending from the larynx to the level of the fifth thoracic vertebra is divided into right and left primary main bronchi at the cardiae. Primary main bronchi or right main bronchus that is a shorter, wider and more vertical, and left main bronchus are longer, narrower and more oblique. Each enter the lung at the ileum. And secondary lobar bronchi arise from the primary bronchi, supply individual lobes of the lungs. Right lung, three lobar bronchi that is superior, middle and inferior. Left lung, two lobar bronchi that is superior and inferior. Coming to the tertiary or segmental bronchi, the branch from the lobar bronchi, each supplies a bronchopulmonary segment. Coming to the pleura. The pleura is a thin double layered serous membrane that surrounds each lungs and lines the thoracic cavity. It plays an important role in the smooth and efficient respiration. And the types of pleura are basilar pleura. Closely covers the surface of the lungs, extends into the fissures between lobes, firmly attached to lung tissues and insensitive to pain. Coming to the parietal pleura, lines the inner surface of the thoracic cavity, divides into costal pleura, lines ribs and intercostal spaces, and diaphragmatic pleura covers the diaphragm. Mediastinal pleura lines the mediastinum, and cervical pleura extends into the neck above the cervical, sensitive to pain. Blood supply of the lungs. Pulmonary circulation for gas exchange. Anteriors, right and left pulmonary arteries from the pulmonary trunk. Carries deoxygenated blood from the right ventricles to the lungs. Capillaries form dense networks around alveoli for gas exchange. And veins are four pulmonary veins, two form from each lungs. Carries oxygenated blood to the left atrium. Coming to the bronchial circulation. Arteries, bronchial arteries, usually two left thoracic aorta and one right from aorta or intercostal artery, supply bronchi connective tissue, visceral pleura and lung parenchyma. The veins are bronchial veins, drains into agos vein that is right, hemizygous axillary and hemizygous veins left. Some blood drains into pulmonary veins that is physiological stunt. Coming to the nerve supply of the lungs, parasympathetic that is vagus nerve CN10 affects bronchoconstrictions, vasodilatation, increased bronchial gland secretions. The functions control normal respiratory activity. And sympathetic that is T1 and T5 segment effects are bronchodilation, vasoconstrictions, decreased glandular secretions. Functions importance in stress exercise, example fight or flight. Visceral afferent fibers or carry reflex sensation that is stretch irritation and pain fibers from bronchi and pleura travels with sympathetic nerves. Coming to the conclusion, the lungs are vital respiratory organ with a complex and well organized anatomical structure designed to support effective breathing and gas exchange. The divisions into lobes and segments, extensive bronchial tree, rich blood supply, and microscopic alveoli ensure effectively delivery of oxygen to the blood and removal of carbon dioxide. The presence of the pleura and pleural cavity allows smooth lung movement and maintain lung expansion during respiration. Together, these anatomical features enable the lung to perform their essential role in maintaining respiration and overall hemostasis of the body. Coming to the references, that is Gray H 2021 Gray Anatomy, the anatomical basis of the clinical practice 42nd elsewhere, and Standarding S 2021 Gray Student Anatomy that is 4th elsewhere, and Mori KL Daly AF Aguirre AMR 2023 Clinically Oriented Anatomy 9th edition Walter Calver, and Senel RS 2019 Clinical Anatomy by Regions 10th edition Walters Claver. Thank you.